Welcome to Falcon Reviews. This section is going to focus on the disorders of the cardiovascular system. My name is Alicia Hernandez and I'm a master's prepared nurse. We're going to do a quick overview of the anatomy and physiology for the cardiovascular system. As we do with all of the other modules, we always start with anatomy and physiology. Okay, so for the cardiovascular system, you've got your heart. And your heart's job is to what? Basically pump blood into the arterial system as well as receive blood from the venous system. So within the heart wall, you've got the pericardium, and that's your outside layer. You've got your epicardium, and that covers your heart muscle. And you've got the myocardium in the middle. The endocardium lines the chambers of the heart. Your heart chambers include the atria, and that is your right and your left upper chambers. The right atrium receives blood from the venous system via the superior and inferior vena cava, and the left atrium receives the oxygenated blood from the lungs via the pulmonary veins. Your ventricles are the right and left lower chambers, and your right ventricle is going to receive that blood from the right atrium, and it's going to pump deoxygenated blood into the pulmonary system by the pulmonary artery, while your left ventricle receives the oxygenated blood from the left atrium and then pumps that blood into the systemic circulation through the aorta. The septum is the muscular partition between the right and the left side of the heart. Within the heart are the heart valves, and their function is to basically allow the blood to flow from the atrium to the ventricle during diastole. It prevents the backflow during ventricular systole, and the mitral valve is located between the left atrium and the left ventricle. The tricuspid valve, it could be found between the right atrium and the right ventricle. The semilunar valves are located at points where the blood exits the ventricles. Their function allows the blood to flow during ventricular systole and to prevent any backflow during ventricular diastole. The pulmonary semilunar valve is located between the right ventricle and the pulmonary artery, and the aortic semilunar valve is located between the left ventricle and the aorta. And I know y'all are thinking, what the heck did she just say? But I'm eventually going to show you a diagram so you can put it all together. Okay, here we go. You've got your right and your left upper atria chambers. So your right atrium and your left atrium. Your right atrium is going to receive the blood from your venous system through your superior and inferior vena cava. And the left atrium over here is going to receive the oxygenated blood from the lungs through the pulmonary veins, which are located on your right and your left. The ventricles are your right and your left lower chambers. And the right ventricle is going to receive that blood from the right atria and pump deoxygenated blood into the pulmonary system, here on the pulmonary artery. The left ventricle is going to receive that oxygenated blood from the left atria, and it's going to pump the blood into the systemic circulation via the aorta. You have your mitral valve, and that's between your left atrium and your left ventricle, and you've got your tricuspid valve between the right atrium and the right ventricle. And remember, its job is to allow the blood to flow from atrium to ventricle during diastole, and not to allow the backflow during ventricular systole. So again, with NCLEX, the exam assumes this baseline information of anatomy and physiology is already understood. So you go in there with this knowledge, and based off knowing how the system works, then it's going to start asking you the questions pertaining to the relevant disease processes that are going to affect the cardiovascular system. So basically, it's up to you to take all the information that you know about the system and then kind of apply ways to help identify and improve that client's state. Now let's review the conduction system. You've got your SA node or your sinoatrial node and your AV node, which is your atrioventricular node. The SA node is considered to be the pacemaker of the heart. It's what initiates the heartbeat. And the AV node, it slows the impulse from the atria while the ventricles are still filling. The bundle of His conducts the impulses to the bundle branch system, and then there's the Purkinje fibers which surround the ventricles. I'll explain this better in the next slide with the diagram. Okay, so here is the electrical system of the heart. and you've got your SA node. It's located within the wall of the right atrium. It's considered the pacemaker of the heart. It generates the electrical impulses there, and they're carried to the AV node, which is located right between the atria and the ventricles. Upon reaching the AV node, the electrical impulses are relayed down the conducting tissue, which is considered the bundle of His, and that branches into two pathways that supply the right and left ventricles. These paths are called the right bundle branch and the left bundle branch. And whenever there's a disruption in this area, then that's where we would refer to that as a bundle branch block. Okay, so your electrical impulses are then generated in the SA node, and they cause the right and the left atria to contract first, and then they depolarize. So your heart muscle contraction is caused by electrical stimulation. This occurs nearly simultaneously in the right and the left ventricles, 1 to 2/10 of a second after the atrial depolarization. So the whole entire sequence of depolarization from beginning to end for the total of one heartbeat usually takes about 2 to 3/10 of a second. All the heart cells, the muscle, and the conducting tissue are capable of generating the electrical pulses or impulses that can trigger the heart to beat. The SA node, again, is the big one. It's known as the pacemaker, or the heart's pacemaker, because that's where the electrical impulses are normally generated. But at rest, the SA node usually produces 60 to 70 signals a minute. And it is the SA node that will increase its rate due to any stimuli. Like if you're exercising or you got some stimulant drugs or a fever, then it'll increase the rate. Should the SA node fail to produce the impulses, then the AV node will kick in. It'll step in and take over. And the resting rate of the AV node is slower. It usually generates 40 to 60 beats a minute. The bundle of His can generate 30 to 40 signals a minute if the AV node can't take over. And then the ventricular muscle cells can generate anywhere from 20 to 30 signals a minute. Any heart rate below 35 to 40 beats a minute for a prolonged period of time is going to cause you some problems, obviously, because there's not enough blood flow to your vital organs. Here's an example of an electrocardiogram monitoring strip. This is going to represent the heartbeat and the electrical system of the heart. To get your heart rate, you can count the number of R waves in a 6-second strip. Each of the small little itty-bitty squares on here are equal to 0.04 seconds. And one large square, which is, 0.20 seconds, is basically 5 of the little squares. The distance across 5 of the large squares is equal to 1 second, which is 0.2 times 5 equals 1 second. If you have 15 big squares, that's 3 seconds. So basically you need to get a 6-second strip, or 30 big squares, and count the number of R waves for ventricular rate and multiply that by 10. For example, if you look at this one, you can pretend this is a 6-second strip. If it were there are 5 R waves here, which we could equate to 5 times 10, which would give you 50 beats a minute. So when you look at this PQRST, what does it represent? Your P wave is going to be the impulse produced from that SA node to the AV node for the atrial contraction. And then your PR interval is the time between the atrial depolarization and the start of the ventricular conduction. Your QRS complex is going to represent the conduction of the impulse when it goes through the bundle of His to the Purkinje fibers. And this is what causes the ventricles to contract. The ST segment, that's the heart's resting period. And then your T wave is just going to represent the ventricular repolarization. And then the heart is ready to start all over again. The circulation within the heart involves the coronary arteries, and that supplies the blood to the myocardium. The coronary veins will return the blood from the myocardium back to the right atrium from the coronary sinus. The cardiac cycle, again, refers to the heartbeat. The 2 atria will contract while the ventricles relax, and this is the diastole. The blood enters the ventricles from the atria, and then the 2 ventricles can contract while the atria will now relax, and that's systole. The ventricles pump blood into the pulmonary and the systemic circulation, and atria receive blood from the lungs and systemic circulation. Here you've got a nice diagram that shows you the cycle for the oxygen-rich blood, which is in red, and then the oxygen-poor blood in the blue. The right atrium is going to receive the blood from the venous system, from the superior and inferior vena cava. And your right ventricle is going to receive the blood from the right atria, and it's going to pump deoxygenated blood into the pulmonary system via the pulmonary artery. Your left atrium receives oxygenated blood from the lungs via the pulmonary veins, that's on the right and the left, and then your left ventricle is going to receive oxygenated blood from the left atria, and that pumps blood into the systemic circulation through the aorta. Okay, so let's look at the heart sounds, S1, S2, S3, and 4. With S1, the sound is created by the closure of both the mitral and tricuspid valves. This occurs at the beginning of systole and at the end of diastole. The S2, the sound is created by the closure of both the aortic and the pulmonic valve. This occurs at the end of systole and the beginning of diastole. S3 is the sound that's created by the blood from the left atrium hitting a large volume of blood in the right ventricle. This usually indicates a systolic dysfunction and a dilated left ventricle, and it is heard in mid-diastole. But keep in mind it can be normal in athletes and young people, and it usually indicates vigorous relaxation. The S4 sound is created by an accentuated atrial contraction prior to S1. The S4 sound is always abnormal, it's never a good sign, and it usually indicates a stiff left ventricle and sometimes a dilated left atrium. The first heart sound, or the lub, occurs when the arterioventricular valves close, or the mitral and tricuspid valves. The second heart sound, which is the dub, occurs when the semilunar valves close, or the aortic and the pulmonic valve close. The functions of the vascular system involve supplying the tissues with oxygenated blood, removing waste, and carrying unoxygenated blood back to the heart. The structure includes the arteries, which carry the oxygenated blood away from the heart and to the tissues of the body. The exception is the pulmonary artery. Remember that the arteries carry the blood away from the heart. All arteries except the pulmonary artery carry oxygenated blood. The arterioles are the small arteries that distribute blood to the capillaries, and the capillaries exchange oxygen and carbon dioxide, as well as other nutrients and waste at the cellular level. They transfer fluid between plasma and interstitial spaces. Now, your veins carry deoxygenated blood back to the heart, and the veins are thin-walled with valves to prevent any backflow. The venules are the small veins that receive the blood from the capillaries. And here you've got another diagram that showcases the circulatory system, and it shows you how the arteries and the veins flow within the body. This concludes the anatomy and physiology portion of the cardiovascular system.